I'm delighted today to have the opportunity to present the HRB's new strategy, which sets out a really ambitious work programme for the HRB and also for health research in Ireland for the next 5 years. The document itself is now available on the HRB website in full, and we'll also be sending you out a copy. But what I want to do now is to highlight the main points and themes so that hopefully you will leave today with a good sense of what we see as the priorities for health research over the next few years. And of course, if you have any questions or comments, please put them into the chat line on the right-hand side of your screen, and we'll be very happy to answer them or elaborate further on any points later on in the Q&A session. Okay, so let's start by looking at the context for the HRB strategy. And of course, right now, COVID-19 dominates everything as we launch a strategy for health research right in the middle of what is a global health crisis. But if COVID has done anything, it has demonstrated quite starkly the link between people's health, the capacity of our health and social care system, and the economy. We know that we need a strong economy to pay for public services, including our health and social care system. But the events of the last year, and indeed the ongoing situation, have reminded us that a strong economy depends critically on having a healthy population and a high-performing health and social care system. And what's more, we've seen that those countries that have performed best are the ones that have invested in research, that understand the value of reliable data and base their decisions on robust evidence. So it's no exaggeration to say that health research is fundamental to the well-being of society and to a functioning economy. Another important backdrop to the strategy is, of course, the Sláinte Care Plan, which sets out a new direction for our health system, all about repositioning our health services to ensure equitable access, but also recognising that the vast majority of care takes place in primary and social care settings, and so moving the focus away from hospitals and towards community-based care. And that has implications for the kind of research that we support. Related to that, we have the realities of an ageing population, with older people being the largest users of the health system. So how we care for people in the future and the sort of care models that we put in place will be increasingly important. We need to consider the increase in chronic diseases and how to address problems like obesity. And we need to recognise the real impact of health inequalities and acknowledge the impact of poverty on health. The Growing Up in Ireland survey, for example, has found that differences in health emerge early on in someone's life based on class, and they widen even further over their lifetime. On a positive note, there is excellent work going on in the HSE to improve the environment in the health service for doing research, with the development of the HSE's new research governance framework. There's also a much better understanding of the importance of health and social care data, and the fact that health and social care data has the potential to transform the way that healthcare is delivered, as well as how we manage our own health. We have very welcome plans from the Department of Health for a national health information strategy that's all about optimising the use of data for health. And this is also important at EU level. One of the priorities for the European Commission is the creation of a European health data space, which is all about sharing data across Europe for better treatment and public health, but also for research. And when you talk about data sharing, then issues of trust are never far behind. It's really important to engage the public in this debate about how their data is used. What's more, there's an expectation now that patients and the public will be involved in health research. We've seen the great interest that the public has in research advances in relation to COVID. And we should build on this, build on the support of the public for health research, and see how we can engage the public more broadly in research and in science. And of course, there are really big developments taking place around genomics and personalised medicine. And to be clear here, we're not just talking about the high-cost therapies that benefit small numbers of people. We're talking about personalised prevention strategies. That's the way healthcare is going, and we need to make sure that Ireland has these kinds of capabilities. Now, let's just zoom out for a minute and look at developments more broadly, because of course health research is part of the national system of research and innovation. And for the first time, we have a government department that is dedicated to higher education and research, that's GFERS, which is a great opportunity now for a more coordinated approach across the whole research system. And we're hoping for a strong focus here on cooperation, taking a whole of government approach to research. The first job for that new department this year is to develop a successor to Innovation 2020. That's a national innovation strategy. It's due to be drafted in the first half of this year and published later on in the year. And we're expecting, I think, a 7-year plan with shorter work programs. But you may remember that Innovation 2020 had a very strong enterprise and industry focus. So there's an opportunity here for that emphasis on research for the economy to be balanced by an equally strong focus on research for societal well-being, and very importantly, research for public policy, and not just public policy for health, but across all areas of government. Of course, we are dealing with the lived reality of Brexit. That means we need to look at how best to support all island research and how to maintain the good links we have with the UK. Another big development starting this year is Horizon Europe, and a much bigger budget this time round for the EU for Health programme, which is a successor to the Public Health programme. We've seen the establishment of the technological universities. We had TU Dublin last year and Munster Technological University due to be designated this year. And of course, for all of us now across the whole research system, there's a real drive towards open science and open research. As we were reminded at our grant holders conference last week, the future is open, and issues like research integrity are really taking centre stage. But above all, I suppose, finally, there's a need to increase national investment in research. I mean, these figures here on this slide show that government investment in research as a percentage of total government spend has declined. It's now less than 0.9%. And that makes Ireland one of the poorest performers in the EU, well below the EU average. And indeed, whatever measure you look at, unfortunately, it tells the same story. So that's an issue that collectively we need to address. So it's against this context and taking all of these factors into account that the HRB started to develop our strategy over a year ago. And in fact, we had quite a lot of work done on it when COVID struck. The approach we had taken was to do a fairly intensive stakeholder engagement. I think we had over 400 inputs to the strategy, and many of you will have been involved in workshops or in interviews. We also had very good input from an international panel who were able to cast and objectify over the HRB's work and help us to put it into an international context and generally to advise us on trends. And we then took all of those inputs into account to develop the strategic themes and refine them further in an iterative process, working with the Department of Health, our own board, and the staff here in the HRB. And it was an opportunity, as with all strategies, not just to identify the key actions and the objectives for the years ahead, but to refresh our vision and our mission and think again about the values that underpin our work. And so we see our vision for the next 5 years as better health through excellent research, data, and evidence. And to get us there, we will support research that improves people's health, promotes evidence-informed care, and creates solutions to societal challenge. Above all, this vision and mission reflects the unique position that the HRB is in as a mission-oriented agency, but positioned at the interface of the academic and the health systems. And they reflect an agency that has a multiple of functions, as a funder, of course, but also as a source of support for evidence and policy, and a provider of independent health research, evidence and data. So to get us there and to realise this vision and mission, the strategy sets out 6 interlinked, linked and mutually supportive objectives. And these include supporting research that makes a difference, being an independent voice for health research, trusted data, a thriving research environment, productive international partnerships, and organisational excellence. Most important, we want to be clear that we are putting the voice of the public, of patients and of carers at the heart of this strategy. And that's because public trust and confidence are essential for health research. The HRB has led the way in Ireland in public and patient involvement in research, and we are committed to continuing that and indeed developing that work further over the next few years. Okay, so let's take a look at these objectives in turn, starting with the first one. So with this first objective, we aim to invest in research that delivers value for health, the health system, society, and the economy. This speaks to the HRB's role as the largest funder of health and social care research in Ireland, and the way in which HRB investment creates the knowledge to address major health challenges. It's about funding research that's relevant and usable, but also research that will have an impact in the future on tomorrow's healthcare. So what we're aiming for here is stronger coordination and collaboration across all the different organisations involved in health research. And we're aiming in particular for a balanced funding portfolio. And that means balancing support for health research that informs decisions and actions in the health and social care system, along with support for high quality investigator-led research. I mentioned the importance of involving members of the public, along with patients and carers in HRB-funded research, and also building capacity in the research community for public engagement. And we also want to put knowledge users at the centre of the research that we fund, from the design to delivery of results. And the reason we're emphasising that is because we know that it leads to research outcomes that are more likely to be applied in practice. And of course, we will continue to aim for excellence in the way we fund research and in measuring the return on investment and on demonstrating impact. The second objective we set ourselves is to be an independent, credible voice for research and evidence and a trusted thought leader. Over the past few months, when it comes to dealing with the COVID crisis, we've seen the importance of using research and evidence to inform policy. But of course, that evidence has to be generated. We need the capacity to do that and the skills to do it well, including the skills to work effectively with policymakers to shape policy. Our own evidence centre in the HRB plays an important role here, as does Evidence Synthesis Ireland and CISR, both of which are funded by the HRB. So we want to build on the work that the HRB has been doing in this space to develop a national, structured and coordinated approach to evidence synthesis. We also want to invest in the capacity to support evidence-based policy making in health and social care. And what we're aiming for is to see research and evidence embedded in key decisions for health and care services and underpinning national health strategies, along with a greater level of awareness of the importance of evidence synthesis. And in doing that, we want to build on the HRB's reputation as a trusted, objective source for health research and evidence. The third objective is to promote and enable the use of data to shape health policy, enhance healthcare delivery, and drive broader research and innovation initiatives. And this is a big and a complex objective. As I said earlier, health and social care data, better use of that data can transform healthcare, as well as helping us to manage our own health. But to get there, we need better collection and sharing and linkage, as well as transparent governance of data systems. So what we want to see here is a national applied data infrastructure that supports research for health, social care and well-being. And again, this isn't just so important at local level. I mentioned earlier, one of the priorities for the Commission is the creation of the European Health Data Space, and we want Ireland to be an active partner in that initiative. The HRB is also responsible for a number of national health information systems in the areas of drugs, drug use, alcohol, mental health and disability, and we will continue to develop and grow those information systems to support policy, planning, service delivery and research. And that HRB data and evidence will be used as key inputs to inform the implementation of the national drugs and alcohol strategies. We also want to make sure that the public, the research community and policymakers have confidence in the way that data, that health data, are used for research, and our support for the Health Research Consent Declaration Committee is part of that work. And we want health research and data in Ireland to be open and fair. The HRB has taken a lead in Ireland in the open research agenda, and in fact the HRB is the first public funder in the world to support an open research publishing platform. Building a strong and supportive environment for health research in Ireland is the theme of this fourth objective. We know that high quality health research needs the right environment. So what we're talking about here is support for people, access to appropriate infrastructure and expertise, and the policies that support good research practice. Over the next 5 years, we plan to invest in research leadership and capacity. In other words, we want to invest in the people who do the research. And that's at all career stages, from PhD level all the way through to senior investigators. We want to see a coordinated clinical trials infrastructure, building on work we've already done in that space, but very importantly, an infrastructure that's integrated into the health system. During the lifetime of this strategy, we really want to make progress on the development of national, shared, high-cost research infrastructures. And being a bit more specific, we want to make progress particularly in relation to biobanking and genomic research. But to do that, we have to take a national coordinated approach, working with the Department of Health, with DFARS, the HSE, and indeed other funders. We're starting to make very good progress in relation to the transformation of the National Research Ethics Committee, the National Research Ethics System in Ireland, with the establishment of National Research Ethics Committees and the establishment in the HRB of a national office. And under this objective, we will continue to develop and shape health research related policies and regulations and support their implementation. We know many of the biggest challenges we face are global, and they're only going to be addressed through international collaboration. Collaboration has always featured very strongly in the HRB's work, and we're continuing that tradition with this objective, which sets out to foster and enhance European and international coordination, collaboration, and engagement. And of course, in doing that, we want to open up as many opportunities as possible for researchers in Ireland. But we also want to meet our own responsibilities to global health and to global health challenges and play our part in contributing to solutions. So we have a number of actions under this objective: partnering in EU and international health research and policy projects that address priority challenges, engaging with, contributing to the aims of the 2030 Agenda for Sustainable Development. We want to support researchers in Ireland to compete successfully in Horizon Europe and the EU for Health programme. And to do that, we will maintain a really good and expert understanding of the European research landscape, which, as everybody knows, can be quite complex to navigate. Finally, we want to aim for organisational excellence, and that means developing the HRB as a progressive place to work, where our people are supported to be innovative and responsive. We're aiming here for a positive organisational culture with the highest standards of corporate governance. And given that we're funded by the taxpayer, it's important that we are able to show value for money in everything that we do. We're hugely dependent on having good quality, reliable ICT systems that are cyber secure and innovative. And as a public agency, we want to meet our responsibility when it comes to sustainability and climate action goals. And we want to enhance communications. We want to enhance the way we communicate both internally and externally, looking at new ways to reach our key audiences so that we can communicate the impact of the HRB's work as clearly and effectively as possible. And that's about building awareness and building trust. I want to close by saying a few words around values, because how we work is as important as what we do. Of course, we want to support high quality research, but we also want to see that research and evidence translated into practical benefits for policy and practice. So we will continue to provide leadership to make that happen, and as much as possible support participation of the health sector in research and innovation. Much of our work involves collaboration nationally and internationally, and that's because so many of the things we want to achieve can really only happen by working with others, whether with the health or the academic system, policymakers, or with other funders. Above all, the HRB is committed to being inclusive. Public trust and confidence, as I've said, are essential for health research, and we're committed to doing even more over the lifetime of our strategy to strengthen engagement with the wider community. More generally, our attitude to health research tells us a lot about our values as a country, how much we value people and their health and the quality of their lives. I started by talking about the impact of the COVID pandemic and how it has brought home the importance of health research. In reality, it's also shown up some of the weaknesses in our research system, and in particular, those areas where we just haven't invested properly over the years, like our public health capacity and in the infrastructure for good quality health and social care data. But at least now we have an opportunity to learn from this experience, and if we invest properly in health research now, if we invest in our future, the next time we're hit with a crisis like this, and there will be a next time, we'll be much better prepared. Finally, I want to thank everybody who's contributed to the development of this strategy. It was developed, as I said, through a process of extensive consultation with our stakeholder community, and I want to thank all of you for the time that you gave and the interest you took. At this point, we're really looking forward, I think, to just getting on with the implementation phase and working with all of you to make it happen. We're going to send each of you a copy of the strategy, and as I said, it's also available on the HRB's website, and it gives a lot more detail on each of the strategic objectives and the key actions under each objective. But for now, we're going to move on to the Q&A session with our panel, and I'm very pleased to be joined on the panel by members of the HRB executive team, and that's Dr. Teresa Maguire, who's Director for Research Strategy and Funding, Dr. Hamish Sinclair, who's Director of Health Information and Evidence, and Martin Morgan, who's our Director for Corporate Operations. And we are going to be kept in line by an excellent moderator, medical journalist June Shannon, who's been keeping an eye on all the questions coming in. So June, at this point, I'm going to hand over to you.